Welcome friends. Myself Dr. C.R. Patil. I am professor in pharmacology at R.C. Patel Institute of Pharmaceutical Education Research, Shirpur, Maharashtra, India. In this series of 4 videos which have been created as out of class activity for open education resource on pharmacology of cardiotonics, I am going to discuss with you the details regarding how cardiotonics exert their action on human heart. But to understand all these details, initially we will need some details on anatomy of heart, circulation of blood to heart, then electrophysiology of heart, and then in the fourth video we will see how cardiotonics modify the activity of failing heart. Let's start with this first video on anatomy of heart. These details we have learned since high school years and even in initial couple of years in your degree classes. Friends, we know that human heart has 4 compartments. While describing them, we use words like right side of the heart and left side of the heart. On right side, the upper compartment is called as right atrium. The lower compartment is called as right ventricle. On the left side, the upper compartment which is present is called as left atrium and the lower compartment is called as left ventricle. Now, whatever blood comes through extremities, the blood which has been deoxygenated by tissues, that blood comes through inferior vena cava and superior vena cava, 2 large blood vessels, 2 large veins into right atrium. So, right atrium is the compartment of heart which receives deoxygenated blood. Now, from this right atrium, blood is pushed into right ventricle. And then, for purification or for oxygenation, the blood is then carried to lungs through pulmonary artery. So, from right ventricle, pulmonary artery starts and it takes the blood to lungs on either side of our body. Now, whatever purified blood is there, that purified blood is carried by pulmonary veins. There are 4 pulmonary veins now, 2 coming from lung on each side. So there are 2 on left side, 2 on the right side. Now these pulmonary veins carry oxygenated or purified blood from lungs, and then when this left ventricle contracts, that blood is pushed into, so left auricle is contracts, that blood is pushed into left ventricle. Now left ventricle is having very powerful wall, and this strength of muscles in the wall of left ventricle helps it to push the blood into aorta, and then this aorta carries blood to all parts of body. So you can understand that there is sufficient resistance to the flow of blood from all these sides. That is the reason why left ventricle needs more strength, and naturally its wall is thicker as compared to right ventricle. Now, these compartments are separated by valve-like structures which allow falling back of blood from one compartment to another. If suppose the blood comes from left atrium to left ventricle, it is necessary that it should not be pushed back into left atrium when this ventricle contracts. Okay. To do this, kind of valves are present on the joint of all the compartments. Between right atrium and right ventricle there will be presence of valves. We call them as tricuspid valves. Between left atrium and left ventricle there is presence of valves, and they are called as bicuspid valves. Between left ventricle and aorta there is presence of aortic valves which are called as semi-lunar valves, because they are having shape like a crescent of moon. And then between right ventricle and pulmonary artery there is presence of semilunar valves again which are called as pulmonary valves. Now, interesting thing to remember in this anatomy of heart is, pulmonary artery is the only artery which contains deoxygenated or impure blood. All other arteries contain purified. And pulmonary veins are the veins which contain oxygenated blood, while all other veins contain deoxygenated blood. So these are the things which we have to remember regarding anatomy of heart. Now in next video, just let us visualize what kind of valves are present and how they are made. This particular animation shows presence of tricuspid valve on between right atrium and right ventricle, and semilunar valves between ventricles and pulmonary artery and aorta. So this is how these valves are continuously functioning. Let us see this video once again. See, these two are bicuspid valve and tricuspid valve. And then this is aortic semilunar valve, pulmonary semilunar valve. Okay. This is aortic valve because it is coming from left ventricle. This is pulmonary semilunar valve. It is coming from right ventricle. Okay. Now, if you see the circulation of blood through heart, just now I have explained how the blood circulates. From whole body, the blood is carried into right atrium through superior vena cava and inferior vena cava. From there, it comes into a right ventricle. Okay? A right ventricle. From right ventricle, it is pushed into pulmonary arteries. Why we are calling them as arteries? Because they are coming out of a ventricle or they are coming out of heart and going to some organ. We call them as pulmonary arteries. Now when this blood is purified, it is carried through pulmonary veins into left atrium, and then from left atrium through bicuspid valve it comes to left ventricle, and then through semilunar valve it is transferred into aorta, and then through aorta this blood will be circulated in the whole body. Okay, so this is how blood comes from lungs, left atrium, left ventricles, then to the whole body. Like this, each time heart pumps out blood into aorta. Now there is a specific word used for this, stroke volume. This is amount of blood which left ventricle pushes into aorta with one beat. There is another word, cardiac output, which is used to tell about the amount of blood pushed by heart into aorta in 1 minute. Okay? Obviously, cardiac output will mean stroke volume multiplied by heart rate per minute. So this cardiac output tells us about amount of blood that is pushed into aorta by left ventricle in 1 minute. And stroke volume tells us about amount of blood pushed into aorta in 1 heartbeat. This is how blood is continuously circulated into all organs of our body. At the center of the circulatory system there is heart which is continuously pumping. It receives blood from the extremities. This blue colored line shows vein or venous system. A red colored line or red color network of blood vessels shows arteries which are originating from aorta. And this whole is representation of circulatory system. This is how heart continuously pumps blood into all extremities, and all our organs get nourishment, oxygen because of working of this heart. Now this nice organ starts beating from the early stages of life, which are embryonic stages. When the fetus is just getting created into womb of mother, at that time this heart starts beating, and it beats up to the last moment of human life. Friends, there is some interesting information available about all these details on this website. You can note down this website here, and I request you to reflect on whatever you have learned in this particular video. Below this video, I have given some questions. You can see how better you understood this discussion by answering those questions. Thank you for seeing this first video. In next video now, we will be studying electrophysiology of heart.